Good evening. Our next class is going to be on patient safety in healthcare delivery. Patient safety in healthcare delivery. What is patient safety? Patient safety is a critical aspect of healthcare delivery, aiming at preventing harm to patients and ensure their well-being. Preventing harm and ensuring well-being is the fundamental right of every patient. Unfortunately, adverse event and error continues to occur, resulting in harm, injury, and even death of the patient. Understanding adverse events, error, and harm in healthcare. For us to talk about patient safety, we must understand the adverse events, error, and harm in healthcare. What is adverse event in healthcare? Adverse event in healthcare is an injury that was caused by medical management. Injury that is caused by medical management rather than underlying disease. And that prolonged hospitalization produce or disability of the time of discharge or both. Adverse event is an injury that was caused by medical management. Injury that was caused by medical management rather than on the underlying disease. And that prolonged hospitalization produce or disability of the time of discharge or both. The Institute for Healthcare Improvement uses similar definition: unintended physical injury resulting from or contributed to by medical care requires additional monitoring, treatment, or hospitalization, or that result in death. Adverse event is the injury that the patient get as a result of either mismanagement of the health workers, poor approach to treatment of the health workers, rather than the disease itself. The injury is not caused by disease, but it is caused as a result of poor medical management. And this is a preventable action that should be taken in the hospital. Error in healthcare. What are error in healthcare? This is the failure of a planned action to be completed as intended, or the use of wrong plan to achieve an aim. An error is a use of wrong plan to achieve an aim. There are a lot of error which includes preventive error, diagnostic error, treatment error, communication error, equipment failure, e.g. misdiagnosis, incorrect medication doses, wrong side surgery. This error comes from preventive when you are making immunization or you are doing preventive care, there are diagnostic error, treatment error, communication error, equipment failure. All these put together are known as error in healthcare. Patient harm in the healthcare. What are patient harm? What is patient harm in healthcare? This refers to all harmful conduct and in particular includes conduct which cause physical harm, conduct which causes psychological harm, for example, causing fear, alarm, or distress. Patient harm in healthcare include conduct that causes both physical and psychological harm to the patient. What are the factors that lead to patient harm? There are multiple functions that leads to patient harm, and these factors are interrelated or interwoven. The first one is system and organization factor. The system and organization factor. The complexity of medical interventions, inadequate processes and procedures, disruption in the workflow and care coordination, resource constraint, inadequate staffing and competency development. Technological factors. Issues related to health information system, such as problem with electronic health record, medication administration system, and misuse of technology. They are the technological factors. When you are administering medication and you have problem with maybe the syringe, you have problem with echocardiographic machine in heart rate, maybe blood pressure, sphygmomanometer. They are all technological factors. When you are taking BP, the mercury is not rising. It's a technological factor, or it's not rising appropriately. Human factors and behavior. This is as a result of communication gap or communication failure among the health workers to other team members or to the patient. Patient-related factor. Limited health literacy, lack of engagement and non-adherence to treatment. When patients don't adhere to treatment, or they engage in some traditional practice when you are treating the patient. Then we have external factor. Absence of policies, inconsistent regulation, economic and financial pressure, challenges. You want a patient to buy drug, there is no money. The patient is supposed to go for surgery, there is no money to make deposit. They are all external factors. Now we are going to look at patient safety. What is patient safety? Patient safety is a discipline that emphasizes safety in healthcare through prevention, reduction, reporting, and analysis of error and other types of unnecessary harm that often lead to adverse patient effects. Patient safety is also a discipline in the healthcare sector that applies safety science method towards the goal of achieving a trustworthy system of healthcare delivery. Adverse events are any incident that leads to harm or loss or damage to people in care, visitors, and workers, It is an outward medical occurrence in a patient or clinical investigation. Safety. We'll look at culture of safety. A culture of safety is in patient safety refers to a healthcare environment where priority is given to patient safety, and all staff prioritizes safety in their daily tasks. This includes open communication, encouraging staff to speak up about safety concerns, transparency, reporting and disclosing adverse events, accountability, holding staff responsible for patient safety, continuous learning, encouraging ongoing for training and further education, patient engagement, encourage patients to participate in their care, safety protocols, implementing evidence-based guidelines and protocol, collaboration, that's encouraging teamwork and collaboration among staff, continuous improvement, regularly assessing and improving patient safety, building safer and more reliable system in healthcare system. In building safer and more reliable system in healthcare involve one, designing for safety. You design for safety. You create a system and processes that are inherently safe, such as using standardized protocols and checklists, implementing evidence-based practices. You implement evidence-based practices, automating processes, improving communication, educating medication safety, enhancing medication safety, using data and analytics, conducting regular safety assessment, ensuring a culture of safety. You ensure a culture of safety, providing ongoing education and training, involving patients and families. Thank you for listening. Like my channel, subscribe and make comment. Thank you.